6:33 is the time. Now, women receiving treatment for breast cancer typically have to undergo weeks of painful and debilitating procedures. But a new single dose, just a single dose of radiotherapy, could change all of that.
The technique known as targeted intraoperative radiotherapy has been described by breast cancer charities as encouraging.
Let's speak to Jayant Vaidya, who's a professor of surgery and oncology at University College London. Good morning to you, Professor. Thanks so much for talking to us. So tell us, how is this different? So just one shot, for want of a better word, of radiotherapy. How is that different to what is happening now for women who are diagnosed with breast cancer?
So women who have been diagnosed with breast cancer, when they have a lumpectomy, after the operation is finished, they have to wait for the appointment with the radiation oncologist and then go every day to the hospital to have radiation to their whole breast for 3 to 6 weeks. Whereas with this treatment, during the operation itself, under the same anesthetic, we give the radiation to the tissues immediately surrounding where the cancer was. That is the device that we use over there.
Oh, can you show us it? How
yes,
is it administered?
So this is the device. It is attached to a gantry, and where the breast cancer has been taken away, this goes inside the breast and radiates the tissues immediately surrounding. And it's well targeted, so it doesn't radiate any surrounding organs. So that is another bonus. And it is finished in 20 to 30 minutes.
Is it more painful since it's targeted?
Not at all. Actually, it is less painful. So in studies, we have found women experience less pain, the cosmetic outcome is better, and their quality of life is better than conventional treatment.
So, Professor, given what you've described and how good it is and how effective it is, what are the prospects for it being used more widely?
Well, with our earlier results itself, around the world, it has been adopted in about 260 centers around the world. There are about 80 centers in US, 60 in Germany and Far East. So about 45,000 women have already benefited from this around the world. And I believe that with these new robust, the highest level of scientific evidence, it should be rolled out soon to everywhere in the UK. And I believe that should what happen.
When you say soon, what kind of timeline are you thinking?
I'm thinking really soon, because to roll it out, the trusts have to acquire the machine, and it is actually less expensive to give this treatment than to give standard radiotherapy. And the training is simple. The surgeons and the radiation oncologist, it is really straightforward to do this, and so it shouldn't really take too long.
So is the equipment readily available to go to hospitals now?
Well, it is manufactured in Germany, and I don't think there should be a problem in getting the equipment within a few months. Yes.
OK, and just to talk about, because obviously it's great talking about new techniques, and especially if it's causing or delivering less pain or resulting in less pain for cancer patients. There is a percentage, though, where extra radiotherapy is required, isn't there?
Indeed. So that is how we designed the trial. It is a risk-adapted radiotherapy that was tested in this randomized trial. So the patients who require this as the only treatment will only have that during the operation. And that is true for 4 out of 5 women, 80% of the women. 20% of the times, once we have done the operation and looked at the tumor microscopically, we find, oh, actually, this patient would benefit from more radiation, and they can have the normal radiation after the operation is finished. And this is the real-life, pragmatic way in which it is done, calling a risk-adapted approach, individualized to the patient's individual risk.
Really interesting.
And so that's what, and we found not only that it is similar in terms of cancer outcomes, there was a statistically significant fewer deaths from other causes as well. That was another bonus, yeah.
Very interesting hearing you explain all of that. Professor Jayant Vaidya, thank you very much for joining us and explaining all of that.